As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, Headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
Good morning. Welcome to the Community Voice. I'm Steve Gradick, your host on this beautiful Monday morning. Glad to have you, Tuesday morning. I normally do Mondays. We're honored to have via phone this morning Dr. Laura Larson and Melissa Robertson. Good morning, ladies.
Good morning.
Hey, all right. Dr. Larson is a medical director of infectious prevention for the Tanner Health System, is board certified in both infectious diseases and internal medicine, earned her medical degree from Mercer University of Medicine, and completed her residency of fellowship at Shands Hospital at the University of Florida, American Board of Internal Medicine and Infectious Diseases, and chairman of the Carroll County Board of Health. And I don't have a long bio on Melissa Robertson. I do know that she's a nurse executive with Tanner Health Medical Center. And again, good morning. I think I know Dr. Larson's bio by heart now, but anyway, thank y'all for coming in. As usual, as we do on a Tuesday, Dr. Larson, if you'll start us off and give us some of the latest statistics, particularly locally.
Sure. As of yesterday afternoon, we had a total of 427 positive tests. That means we have had a total test resulted of 3,926. We have 53 test pending results, and our percent of positive tests have gone down. Our percentage of positive tests are 10.88, and that's very good news. Our number of patients in the hospital has gone down as well. We have a total of 13 patients as of yesterday afternoon in the hospital with confirmed COVID and 22 suspect patients. So far, we've admitted 145 patients and discharged 106, and we've had a total of 27 deaths. So that's where we are right now.
Let me ask you, there are a lot of things about all of this that tend to confuse me. One of them is we got a press release this morning or late last night from the governor's office, and he's reporting the lowest number of ventilators in use to date in Georgia, and the number of positive patients is the lowest number since they started submitting to the Georgia Emergency Management. Yet the Georgia Department of Public Health is reporting an increase of positive cases from Sunday, and that the number of deaths across the state increased 37 yesterday over the previous Monday. How do you reconcile what appears to me to be a little bit of a disparity?
The hard part about all of the reporting is that our cases wax and wane. Last week we did hit our lowest numbers of having 2 days in a row where we had no cases. Over the weekend we've seen a slight uptick, but it's not what I would necessarily call a surge yet. So by the time we report those to the state and by the time they get to the governor, there's a lag with that. We put those numbers in ourselves into the state system. The Department of Public Health confirms them, so the Department of Public Health has that information before it channels up to the state. As for the deaths, for us, 3 of our deaths occurred just since Friday, and these are people that had been in the hospital. One had been in the hospital quite some time. One of the had been in the hospital less than 24 hours. So the deaths are sporadic too, and I think that the death is the last numbers that would ultimately go down if we saw a decline in overall cases, and if this were to burn out, we would still see deaths being kind of the last thing that would go down necessarily, but it's just sporadic.
We spoke last week about the predominance, which follows the national trend of our deaths here locally coming from nursing homes and assisted living facilities. Is that trend still in place?
Yes, but we've had some younger deaths. We've had deaths in the 30s and 40s range, which, is not necessarily. We knew going into this that was a possibility. It's just it's hard to see that happen.
Ms. Robertson, I guess I should refer to you as Nurse Robinson. I'm not, whatever title.
No, just Missy would be fine.
Missy, okay. Well, Missy, bring us up to date on inside the walls, if you will, of Tanner Health System and Tanner Medical Center. I know that it's been a challenge for all the nurses there and the frontline workers and from people on the outside looking in, a little bit of concern and fear and whether or not we should re-engage with Tanner. So just if you would bring us up to date from inside
Sure.
Tanner.
Dr. Larson and I have partnered with our senior executives and materials management early on as we saw the pandemic moving towards us and through Georgia, to be very aggressive in our approach with early use of PPE to protect our workforce and to protect those around us. So we have created zones of isolation for those patients who are either being tested for the COVID-19 or who we know are positive, and even those who have symptoms that are that look like they have the COVID-19 infection, but we can't confirm it with testing. So we've created those zones of isolation so that we can maximize protective equipment for our clinical staff and to ensure that we have cohorted those patients in such a way that we protect our patients and populations here that are not currently infected. So that's what we've done to maintain safety within acute care. But in our outpatient settings, we have screeners who are speaking with patients and any visitor that may come with them to perhaps our ED. So we provide masks for our patients. All of our clinical staff wear masks and eye protection at all times, not just to protect themselves, but the wearing of a mask and eye protection is protective of others as well. So if I had an infection but was not yet symptomatic, if I coughed or sneezed, then that would contain that and protect those around me. So we have been rigorous in our use of protective equipment and rigorous in the provision of masks for people that are coming in, which makes our emergency department and our outpatient setting and testing safe for our community. So we want to be sure that everyone knows that it's safe to come to the hospital and get the care you need. We worry that perhaps some out of fear haven't come to be seen or cared for, and we want to be sure that message rings out to the community.
Did any of your clinical staff contract the virus?
We really have had a pretty healthy workforce overall, and with the implementation of this protective strategy, I think we have fared better than most around us. So we are pretty pleased.
Dr. Larson, another thing that confuses me before we go to our first break is testing. There's a lot of chatter, a lot of talk now about testing, the increasing number of testing. But frankly, I don't fully understand. You can have this virus. One day you don't have it. The next day you do have it. You're asymptomatic. If you do have it, then you're supposed to quarantine for, minimum of 2 weeks. How does testing for people who do not have symptoms, how is that valuable?
Well, that's a difficult question, but it's valuable for people who may have had an exposure, in my opinion. So the way that this works is if I have COVID and I infect you, you're going to show symptoms anyway. If you get infected, you're going to show symptoms. The incubation period is 2 to 14 days. So anytime after 2 days after that exposure, up to 2 weeks after that exposure, you could become ill. We know that there's a period of time for maybe 2 to 3 days that you may be shedding or pre-symptomatic, or you may just be asymptomatic and infected and shedding virus as well. So to me, an asymptomatic test really makes a lot of sense for people that have been exposed. And I know that our governor is strongly pushing to make sure that everyone who wants a test can have a test. And I think that's why you're seeing some information about testing for people that are symptomatic and asymptomatic. In the beginning with the availability of testing, obviously we were testing people that were symptomatic because we just didn't have enough testing available. And now that testing is more available, I think that it's just been opened up to people that are potentially exposed and people that just want to be tested with a variety of symptoms or no symptoms.
Does Tanner help facilitate those tests?
So we have paid more of the symptomatic approach, and obviously our patients, the emergency room, we've talked to them yesterday morning, and some people are coming in that have been exposed and want to be tested. So they're certainly more liberal with that than we were in the beginning. The Department of Public Health also has test centers all over the state, and they are opened up now to testing symptomatic and asymptomatic persons, and that information can be found on the Department of Health website, and that testing is actually free. We don't know, where all of this funding for all of our testing is going yet. It should be free if it actually does trickle down, but right now we just don't know in our own hospital walls what that looks like yet.
Our guests this morning are Dr. Laura Larson, Medical Director of Infectious Prevention for Tanner Health System, and registered nurse Melissa Robertson, who's nurse executive with Tanner Medical Center. You have any questions, you can post them to our Facebook page. We're streaming live to our News Talk 13 Facebook page. And, of course, we're on News Talk 1330 FM 106.3. We'll be back in a moment after this.
As we journey through this global pandemic together, Oak Mountain Academy is lifting everyone in prayer and holding the community in our hearts. We continue to pray for all of the families directly impacted and the first responders and medical personnel on the front lines. There are so many individuals working around the clock to keep us safe and healthy. I'm Patrick Uran, headmaster, asking you to join all of us on the mountain in prayer and gratitude for everyone in our community. For more information about the Academy, visit us at oakmountain.us.
For more than 70 years, you have turned to Tanner Health System for your healthcare needs. As our community moves forward, Tanner is here for you. Strong, safe, and close to home. Routine medical appointments, urgent elective surgeries, and imaging are back on the calendar at our hospitals and Tanner Medical Group practices. With the safety of our patients, staff, and community always our top priority. Learn more at tanner.org. #WeAreTannerStrong. That's tanner.org. #WeAreTannerStrong.
Good morning. Welcome back to the Community Voice. I'm Steve Graddick, your host. Delighted to have you with us this Tuesday morning, and we're honored to do our Tuesday show again with Dr. Laura Larson. And we're also joining her is Melissa Robertson, an RN, a nurse executive for Tanner Medical Center. And both of y'all can address this. I'll go to Dr. Larson first, but in the beginnings of this pandemic, there was a lot of talk, and we talked about it in the very early days of the coronavirus being really nothing more than another type of flu, if you will, that long term we may never see a vaccine. It has similar, although somewhat different, symptoms as the normal flu does. Now that all this has passed, and both of y'all can respond to this, do y'all see or do y'all feel like the coronavirus is more similar to the regular old flu than maybe what we thought in the beginning? Okay. There you are. I'm sorry we had a little technical glitch there. Did y'all hear that question?
I didn't. The audio just came on.
Okay, I'm sorry. Well, our audience will have to endure my repetition of it. I apologize. We had a little technical thing there. In the early days of the pandemic of the coronavirus, we oftentimes compared the coronavirus to the regular flu. And as time went on, we moved away from that. As we start to wonder now if there will ever be a vaccine for the coronavirus, and we see that a lot of symptoms of the flu and the coronavirus are shared, is that a fair comparison? And both of y'all can respond to that.
I think this one has a lot of characteristics of flu, but more than that. This one is widely variable. There are a lot more GI complaints with this one, with nausea and vomiting. What surprises me sometimes is the lack of respiratory symptoms in some people, and this anosmia, the inability to smell and the inability to taste, is not something we typically see with flu. And then there are a lot of vascular derangements that we don't see with flu. We are seeing people that have strokes and DVTs in children with a Kawasaki-like disease, which Kawasaki's is like a vasculitis in children. And so it's very different and from flu in that sense.
We've seen a lot of very wide variation in how sick people feel, for lack of better. Some people feel very minimally unwell, and then some are critically ill, and there's not always a rhyme or reason as to who becomes very unwell. So.
And that's the thing that, everybody always asks me, why are you so concerned about this as a healthcare worker? And I guess the thing about it that bothers me, someone described it to me as Russian roulette. We don't know what triggers terrible disease in some people. We know what the underlying risk factors are for getting bad disease, but when you have somebody that just has mild hypertension and you have somebody that has really no symptoms go from being well and to being critically ill and dying, that's what bothers me as a healthcare worker. Is we just don't know what triggers those severe cases in every person.
You mentioned in your answer there, and this has become a very recent news story about children. We're hearing that more children have become infected, but this has, I think they referenced Kawasaki disease, and there's a symptom called COVID toes. Bring us up to date, both of you, if you will, on these new reports that children can contract this ailment.
So, initially, when we heard about this and had the information from other countries, we were under the impression that children were really spared and not getting sick and were mostly asymptomatic. And then a couple of weeks ago, we started getting reports from Europe of a vasculitis-like disease in children that was happening not necessarily the acute phase of illness, but about a month to 6 weeks after children were infected. And then we started seeing similar cases in the United States like that. And so my understanding at looking at this recently, a couple of children have died from this. It's not a large number, but we went from thinking that this was not going to affect children to knowing that it can affect children. I don't think we've fully worked out what exactly that disease looks like. And I'm not a pediatric infectious diseases doctor, so those will be seen typically in somewhere like Children's Healthcare of Atlanta if we were to have a case like that here.
Okay, fair enough. On our Facebook page, we've got a question from Leanne Auer. I'm probably not pronouncing that correctly, but the question is, should the general public still be wearing masks when doing things like grocery shopping and interacting with those outside our home? I'll leave Missy, you want to tackle that one first?
Sure. I think Dr. Larson and I are in lockstep in our perspective that we know that masks and eye protection is protective against incidental exposure. So because we may not see conversion to or symptoms early on post-exposure, you can't really predict whether someone you're near is sick or not. So to protect yourself and to protect others, we think that is what will control transmission in the community as we open things up in Georgia. ensuring that people wear masks and eye protection will help us to prevent further transmission, we think.
I've heard that wearing a mask really protects your fellow person more so than yourself. Is that true?
Both, really. I think we think that it is protective both for the wearer and the people around the wearer. We've seen that to be true in our work environment.
And the recommendation in terms of type of mask, do you have any?
I think the CDC, you want to speak to that, Dr. Larson?
Sure. I know we have more masks available, more surgical masks. I think the surgical masks are more protective than cloth masks, but cloth masks are protective of the wearer. So, I've had a lot of people say, well, I don't have any masks, but if you at least have a cloth mask, you can protect yourself from transmitting to others, is how we look at that.
Okay. Let's, since both of y'all are on the front lines, and these two questions have been with us since the beginning, and that is therapeutic treatment for this disease, chloroquine or remdesivir. Have y'all utilized any of that at Tanner? And if so, what kind of results did y'all see?
So we have prescribed hydroxychloroquine, or Plaquenil. We haven't done chloroquine. Pretty early on, the information came out that Plaquenil was probably a safer drug. We have not necessarily seen any consistent results one way or another. I think once this is all over, we can sit down and compile that data and look at it. We have used it in settings of people that we have the fear of progression to severe disease. Initially, we used it pretty frequently. We've backed off on our use of it more as more data have come out that maybe it's not necessarily effective. We just don't know yet. Until the large clinical trials come out, we usually counsel the patient, counsel the family, and see if they want to try it, understand the benefits. We don't know if there are any benefits. We know there are risks, and so we talk to each of those families and patients individually. A study came out from the New England Journal of Medicine in the last week of 1,400 patients showing no clinical benefit in terms of it did not reduce the risk of ventilation and death. And that's a lot of patients, 1,400 patients, and that there were some patients in that study that had to stop due to heart effects. So in terms of remdesivir, that is the Health and Human Services sent out information that they would start sending that drug to states and that it would be allocated to those areas of highest need. I talked to our Department of Public Health yesterday about that. We have not yet received it. And we also talked to our medication suppliers, McKesson, very often to see if we're going to be able to get it through that route as well. But so far we have not been able to. We have used convalescent plasma in patients. And I think it's too early to tell with our small numbers if that's been effective for us yet. Okay.
We're only going to have about 5 minutes left, and so I don't want to feel like I rush y'all like I did last week. But I saw a story over the weekend that was kind of troubling, and I'm probably not describing it correctly, but it said once you contract the coronavirus, that inside the body, among all the organs, that there could be mutations of the virus, which is pretty scary. I'm not really sure what it meant, but Dr. Larson, can you elaborate on that?
We already know that from the time the virus left other areas that we've had mutations. We've even been able to track where the viruses probably came from like the East Coast, and where the virus came from the West Coast. So, yes, it's a coronavirus that typically, those can mutate. What that means going forward, we'll just have to wait and see. My hope would be it would mutate into something that would be less infectious or less virulent, but it could go either way.
Okay. When we began this about 2-3 months ago, there was a lot of speculation that if we could just make it till June, the sun would come out and the UV rays would kill the virus and it would be all good, kind of like the flu. Do y'all hold to that, either one or both of y'all, or what's your opinion about sunshine on the controlling this pandemic?
I know that UV light can kill coronavirus, but I don't know people don't necessarily infect other people only in the sunshine. So I don't really know yet. I think it's just too early to tell.
Okay. Missy, do you have any hope about that? The better way to ask the question is, I want a good reason to go to the beach. You know what I mean?
Yeah, I think we just don't. We say a lot at times. We don't know what we don't know. Yeah. So. Yeah.
All right. As we wind down the program, and I've got a couple more questions on our Facebook page I want to address, but let's if each of y'all would kind of give me your perspective going forward. And this has been a long, traumatic, and I know super exhausting episode in your lives, but I think in everybody's life to a greater or lesser degree. Some people more impacted, obviously, than others. Some very tragically. But going forward, what's y'all's vision for us as a nation, for us as a local community going forward?
I want to mention that I really think that our community has been fantastic in all of this, and especially if people ask me why haven't we had more cases or more deaths. I think we're a smaller hospital system, and we were small and nimble, and we were able to do a lot of things to be prepared faster than a lot of places were necessarily prepared. So I've seen our community be incredible and rally. I think there's still a lot of anger in the world right now about what has happened, and I hope that one day we can kind of all settle and take a big breath and realize that we all did the best that we could right now. But I just want to say I'm very thankful for where I work, and I also want to mention that it's the last day of Nurses Week, and the nurses have been fantastic with this, and they are really the frontline people because they're in the rooms with patients a lot longer than I am. And there's so many healthcare workers that I really, really appreciate. So that's kind of where I am right now with our community and going forward.
Missy?
Yeah, I agree with Dr. Larson. I've been very, it's such a positive thing to see the responsiveness of our community and their kindness to us as healthcare workers and through the community taking care of one another. And it's been great to see the resilience that I see. We have the good fortune that we were able to be nimble and make changes that were needed through the support of our leaders in our organization. And it's been very positive. I think what does not overcome you certainly strengthens you, and I think we have seen that through this process. I don't think we will ever be the same as far as how we look at care and our population. A pandemic will make changes in the way you approach things, but very appreciative of our community, want them to feel comfortable that they can come to us and that we'll provide care for them in a way that keeps them safe, and very appreciative of their support through this very difficult time.
Our gratitude this morning, Dr. Larson and Melissa Robertson, and to our sponsors, Tanner Health System and to Oak Mountain Academy. Go out and make it a great day. You're in tune to WLBB Carrollton.